For the next myofascial release, we're going to be focusing on the lateral portions of the thigh. We could call it the IT band. It's the muscles right here on the lateral portions of this of my thigh bone. Now, the reason that we want to get into this particular region, once we've kind of developed restriction in the rectus femoris and just in general an adaptation to sitting overall, what's going to end up becoming problematic will be the way that we move after that. Our movements are going to become overcompensatory. It's going to become dysfunctional. And sometimes it may not even have to do anything with the sitting at all. It could be genetic. It could be trauma. Learning how to move is a complicated thing, and nobody really has movement 100% figured out. So just in general, humans come with imbalances. Animals happen to be asymmetrical. Every animal that I've ever seen happens to prefer to rotate to one side or the other. I have dogs, and they all prefer to rotate to one side or the other. So imbalance is almost a natural part of the process, and humans are possibly one of the only organisms that might be able to achieve balance from one side to the other. And so it might not even just be environmental, but just keep this in mind that everybody has a preferential mode of operation in space. And if there's one thing that you want to think about when you're moving in gait, is that there's going to be times where hips will move in particular fashions. You guys will kind of see me here rotating. You'll see me shifting. You'll see me going forward and back as I shift my hips back and forth here. You'll see motions happening. And when I walk, there's going to be a ratio between how much motion I'm going to get in every plane of motion. So let's say this is another range of motion. We'd call this a frontal plane of motion, a hip hike. We'd call this a hip shift. We'd call this a rotation, right? And everybody has a certain set of ratios that they like to operate with whenever they walk. Some people like to shift more. Some people like to hike more. Some people like to rotate more. And then you'll have some people that like to shift forward and back more. Now, the biggest concern that I have with people in our culture is that they don't necessarily shift as much as they should in the way that they need to. They don't necessarily rotate as much in the way that they need to, but they certainly do tend to hike a lot more than they need to. And again, the hike typically comes along with the shift. It's never in isolation, but if there is one thing that happens too much with people in our culture is that they tend to hike their hips too much. You'll see kind of how I'm trotting my hips up, and the time that it normally happens when they walk is at the point which they land and they hit the ground. It's usually when you'll see this hiking motion happen at the hip joint, and what that ends up causing is a great deal of problems to the quadratus lumborum. But now what comes along for the ride with that is the IT band. You'll start seeing that these IT bands are highly involved in this way of stabilization. This frontal plane dominant stabilization is what causes these IT bands to end up taking so much of the load when we're moving in space. And so the reason that this area, the IT bands, become problematic is because we're not using them the way that they're supposed to. We have an Achilles tendon, we have a thoracolumbar fascia, and we all know that we're supposed to load them to some degree when we're in motion, but people don't think that the IT band is actually supposed to be somewhat malleable, and it should almost work like an Achilles tendon if you are using it correctly. Again, that emphasis on looking at those ratios will be really important as it relates to how these IT bands work. Remember, we're not supposed to have IT bands work within the confines of the hip hikes. There needs to be shifts. There needs to be rotations involved in the body, rotations involved in the trunk to offset that constant pressure going to the IT bands. And once we offset that pressure, we'll get more buoyancy. And if we get more buoyancy, just better slinking capacities out of our legs altogether. So let's get into the application of the IT band release. So what we're going to be doing here is, first and foremost, we're going to be locating the exact lateral portion of the of the thigh. So if you could just think about a 90-degree angle between the front portion of the thigh and the lateral portion of the thigh, and that you want to get on that lateral portion of the thigh almost perfectly onto that 90-degree angle. And we're also going to begin to focus on getting onto the more of the upper portions of the thigh. From there, we're going to step over with our posterior leg, the one that doesn't have the pressure on it, and we're going to begin to think about putting pressure on that leg to alleviate the pressure on the ball in case this hurts too much for you. So essentially what you'll want to do is use this as your base of support. So when if you feel too much pain here, you can take off the pressure and make it a little bit more accessible for you. But if you feel that you can take the pressure, you're going to release all the pressure off of this foot and just let it onto the ball. Now you'll look at my shoulder. It's pretty much over my elbow here, so I have a good base of support in my upper body. But really the main place I should be taking the weight here should be my thigh. From there, I'm just going to have myself, again, rolling back and forth, up and down. I like to focus on the upper portions of the IT band. That seems to be the area that gets the most dehydrated of all the points on the IT band. You can focus on trying to get down to closer to the knee joint and seeing how that works out for you. I'm sure there's an advantage to that, but if I'm thinking about what gives people the most relief, like on their knees or their lower back, whenever I give them a release, it's usually all the way up in these regions here where they'll feel the greatest sense of relief doing these this specific MFR. There's nothing really complicated about it. Again, just aim to be perfectly lateral on that thigh, thinking about that 90-degree angle. Because, I mean, you can move a little bit further forward on the thigh and a little bit further back. We'll be getting into the anterior and posterior 45s next week, which will cover kind of like the anterior portions of the IT band and the posterior portions of it. But for right now, what I want you guys to just think about is getting completely lateral. If there's another thing I want you guys to take into consideration is that part of that IT band directly attaches onto your glute max, and then the other part attaches directly under your tensor fascia lata, which is a muscle right here on the front side of the hips. And so anytime that you get those dysfunctional walking mechanics, the dysfunction is either going to orient from the tensor fascia lata on the front side or the glute max on the back side. And ultimately, if you want to have functional glutes or TFLs working on either end, this area right here needs to be able to accommodate that. That's just another little tidbit of information to think about with the release of this tissue. Now, again, for some of you, this may be a breath taker. It can hurt quite a bit. That's why you have these bases of support to relinquish that pressure. Again, always be mindful of those pain tolerances and don't push it too far. If you feel like it's too painful, ease up on it and don't go too crazy on the release. Again, we got to think in terms of we have to think in long terms here, not necessarily in terms of what's going to give me relief immediately. For many of you, if you have lots of imbalances on your body, it's important to take into consideration that you didn't just develop those imbalances overnight, and sometimes you'll have to take time. So remember, more pain here doesn't always equate to better. Again, it's tolerable pain, dealing with the discomfort, but not making it an overbearing discomfort. Anyway, that's the IT band release. Let's move on to the next technique.